Hello. In this section, we're going to discuss several dental diseases that affect the teeth. Let's start with dental caries, which is a term for known as cavities. Dental caries is the most common of the dental diseases. Worldwide, approximately 2.4 billion people, or 36% of the population, have dental caries in their permanent teeth. In the US, dental caries is the most common disease of childhood. It is 5 times more common than asthma. In addition to caries, we're also going to discuss erosion, abrasion, and pulpal conditions. Caries is basically the localized destruction of tissues of the teeth by bacterial fermentation of dietary carbohydrates. It is a chronic endogenous infection that is caused by members of the normal oral flora. The result of the caries process, the caries lesion, is a manifestation of the mineralization of enamel, dentin, and cementum. The development of caries is a multifactorial disease that is dependent on 4 aspects. The most important one is the development of the bacterial plaque, which sets the caries in motion. The second one is the quality and quantity of the salivary flow. The third aspect is the presence of minerals such as fluoride. And the fourth aspect that you need to consider is the quality of nutrition. Caries is definitely associated with diet which is rich in refined carbohydrates and is associated with foods which are sticky to the tooth structure. Caries can affect both the baby teeth or the deciduous teeth as well as permanent teeth. And caries can also develop in different locations on the tooth. There are caries which develop in the pit and fissure caries, sometimes referred to as occlusal caries. They can also develop on the smooth surfaces on the teeth, either in between the teeth known as interproximal, and also on root surfaces of the teeth. Those caries on root surfaces generally develop more in older age. Pit and fissure caries can start developing actually within days of tooth eruption, providing that the diet is rich in suitable carbohydrates and begin shortly thereafter. Compared to coronal smooth surface caries, proximal caries progresses much quicker because it can pass through enamel much more rapidly. As mentioned, root surface caries develop in a later age. Caries can affect both the enamel, the dentin, and the cementum. And caries which affect the cementum or the root are particularly difficult to manage because cementum has the least calcium. It's the softest of all the mineralized structures in the tooth. There are caries which are associated with radiation. Radiation in certain cancers, head and neck cancers, destroys salivary glands. Those patients suffer from lack of saliva, which is a protective function, and they tend to develop caries at a higher rate. And there is also something which we refer to as rampant caries, which occur in people with bad diets and with very poor oral hygiene. There are also the secondary recurrent caries which can develop under poor fitting restorations. In those restorations which are not well adapted or do not form a perfect seal, they form an area where a patient has a difficulty in plaque control. The baby bottle caries, or the caries which occur in very young children, usually occur when there is a very poor oral hygiene and where the diet is very rich in fermentable carbohydrates. Such caries usually develop within months of tooth eruption, and they do so when the diet is rich in sucrose, glucose, and sticky foods. Bacteria metabolizes sugar, which produces acid. This acid then tends to soften and break down the tooth structure. Therefore, a high sugar diet is a risk factor for dental caries. Dental caries is more common in the developed world due to the high sugar content of the diet. The frequency that bacteria are exposed to sugars definitely affect the likelihood of caries development. This is why snacking between meals promotes caries. The saliva plays a very important role in control of caries. It is a fluid secreted by the salivary glands, namely the parotid, the submaxillary, sublingual, and other minor glands. It contains a pH buffering capacity, cleansing effect, antibacterial action, and remineralization by salivary calcium. Individuals with dry mouth, known as xerostomia, due to radiation therapy, certain drugs, or other diseases, exhibit increased rate of caries. In humans, some of the more important bacteria that have been associated with different caries are the Actinomyces viscus, Actinomyces neslundi, the Lactobacilli, Enterococci, and the mutant Streptococcus bacteria. Mutant Streptococci bacteria are actually important for the caries to develop. Its virulence of the strep mutants is actually due to the adhesion, acidogenesis, and adhesion colonization, i.e. formation of biofilms. The host factors which can influence the development of caries are the tooth location, the presence of sugars and sticky foods, frequent snacking, inadequate oral hygiene such as brushing and flossing, lack of fluoride either in the diet or in the water or in the toothpaste, lack of saliva, and various types of eating disorders. The best way to treat caries is actually prevention. Oral hygiene is extremely important. This includes daily brushing and flossing to inhibit the development of the bacterial biofilm. Regular visits with the dental hygienist are needed to clear away any remaining plaque and calculus. Fluoride plays an incredibly important role in caries prevention. It both strengthens the teeth and inhibits bacterial ability to ferment sugars. Fluoride toothpaste, fluoride rinses, and water fluoridation are all measures to ensure that teeth have enough exposure to fluoride. According to Center for Disease Control, water fluoridation is one of the top 10 greater public health achievements of the 20th century. Once caries develop, the way to treat them is to remove the decayed material and placing filling materials or crowns. This includes excavation of all caries tooth structure and placement of filling material to restore the tooth to proper form and function. Other types of conditions affecting the teeth are erosion, abrasion, occlusal trauma, and pulpal conditions. Erosion is the loss of tooth structure due to chemical acidic breakdown from a non-bacterial source. That happens frequently in people who have acid reflux and have very acidic saliva. Erosion is many times associated with bulimia. Dental ablation is the loss of tooth structure due to mechanical wear and incorrect brushing techniques. This picture shows you the example of toothbrush abrasion due to incorrect brushing. Attrition is a loss of tooth structure from opposing teeth. This condition is found in patients who have excessive tooth grinding. This condition occurs frequently in patients who are emotionally stressed, and they tend to grind the teeth either during the day or at night. Affraction are lesions at the gum line thought to be caused by flexural forces that degrade the tooth structure. Occlusal trauma is a damage incurred by teeth or surrounding structures due to traumatic occlusion. Traumatic occlusion happens when the forces acting on the teeth exceed the capacity of the periodontal ligament to withstand such forces. There are two types of occlusal trauma. The first type, the more common type, happens when there are excessive forces acting on healthy periodontium. Example of such forces would be excessive grinding, clenching, chewing on nails, pencils, etc. These conditions, occlusal trauma, can be treated by occlusal adjustment, realignment of the teeth, and also by appliances such as night guard. Secondary occlusal trauma happens when there are normal occlusal forces, but the periodontal support is compromised and weakened by periodontal disease. The treatment for this condition, of course, requires, if possible, regeneration of the supporting structures and also splinting of the teeth to distribute the forces more equally. Caries, when it becomes severe, can actually penetrate the nerve of the tooth. When that happens, a pulpal condition happens. The nerve becomes infected and becomes slowly but surely destroyed. The toxins and the byproducts from this infection can then spill into the surrounding bone. Even if a filling is placed, the immune system cannot clear the infection in the pulp chamber, and therefore the pulp tissue needs to be removed. This treatment is known as the endodontic therapy.